It will be a long 28 days before these malaria patients can be declared completely free of the parasite. If they return to their villages before then, they risk infecting others with the mosquito-borne virus. So they wait in hospital. But despite the medical community's best efforts, danger looms. Resistance to the drugs which fight malaria.
As the report, they said artesunate in this box has some degree of resistance.
Artemisinin is the world's most common treatment for malaria, used in combination with other drugs. Researchers first noticed it wasn't working as well in some patients along the Thai-Cambodian border. The race is on to contain the resistant parasite.
If we cannot stop the drug resistance, especially artemisinin-resistant malaria, if it spread to any other area, that means it will rapidly spread to all over the world. And of course, the incidence of malaria patients will increasing and also mortality rate.
Experts blame incorrect diagnosis, leading to the overprescription of malaria-fighting drugs. Thailand has some of the world's top diagnostic facilities, but most other countries in the region still rely on clinical suspicion, meaning people with a fever often mistakenly get treated for malaria.
International funding for malaria control has increased by over $1 billion in the past 6 years. But 80% of that money has focused on the African region. Here in Southeast Asia, there is a much higher risk of mortality, yet this region receives the least amount of money per person at risk.
The World Health Organization says funding still falls well short of the $5 billion required annually worldwide. Huge inroads have been made in containing malaria, now said to be a risk for half the world's population. The parasite resistance shows it's more important than ever that researchers are able to keep one step ahead of the disease. Aela Cullen, Al Jazeera, Bangkok.